Today I'm talking to Dr. Mairead Murphy from Bristol and Professor Chris Salisbury from Bristol, and we're talking about their paper on continuity of care.
I wanted to explore further what it is that people with long-term conditions value most in their GPs, and of these, what is facilitated by relational continuity, by seeing the same GP over repeated consultations. And, you know, we often talk about relational continuity of care as if it's an end in itself, but really it is a means to a number of ends. So I wanted to unpick what general practice seeks to achieve through continuity of care. Now, how we did this study was we went into waiting rooms and recruited patients there for interviews. So we were looking for patients who had recently seen a GP and patients who often saw their GP. And we read through the data and looked for particular themes. So what attributes and behaviours patients wanted to see in their GPs, because we already know that patients, particularly people with long-term conditions, value seeing the same GP over time. But what we wanted to look at was why, what is the end that patients are trying to achieve by that. And we found 9 key attributes and behaviours that patients with long-term conditions really value in their GPs. So we group these into knowledge and technical competence on one hand and attitude and approach on the other. So the knowledge and technical competence attributes and behaviours, where patients want a GP who's clinically competent, who will examine them where they think it's necessary, who knows their history, and who gives clear and consistent advice. In terms of attitude and approach, patients want a GP who listens to them, who takes time with them, who cares about them, who takes responsibility and action, and who trusts and respects them. Now then, looking at the interviews to see which of these attributes patients thought were facilitated by relational continuity, there were 4 that really stood out that patients thought continuity of care facilitated. And those were a GP knowing their history, giving clear and consistent advice, taking responsibility and action, and trusting and respecting them. But we then looked for divergent cases in the interviews where patients described times where these things were achieved without continuity of care. And really then only one of the attributes and behaviours stood out, and that was trust and respect.
What is the key message from this study for me as a GP?
So when you're in that consultation, you should consistently seek to demonstrate trust in your patients, especially when you haven't consulted with them before.
So as GPs, Chris, we feel that continuity of care is one of our core skills in general practice. Why do you think continuity is important?
I think it's important both from the doctor's point of view and from the patient's point of view, but this study is really about the patient's point of view. And we know that continuity is declining for lots of complicated reasons, and we wanted to say, look at what is it that's so important to continuity for patients, because we know it's important. And I think what we learned was it's about somebody who knows about you, knows your history, so you don't have to repeat yourself over and over again. It's someone who gives you consistent advice. We've got quotes from patients who hate being told different things by different doctors and then they're confused about what to do. It was particularly striking how they wanted someone who took responsibility for them, who had a kind of duty of care and would continue to follow things through and not just try and deal with the immediate problem. And the other thing that really struck me was this sense of being taken seriously, that the doctor doesn't kind of minimize what you say, that they understand and believe you and take you seriously. And that was something that people really valued, that they got from an ongoing relationship with the GP, that they sometimes didn't get when they saw doctors they didn't know. Although they sometimes did get it, it was sometimes possible to get that from a doctor that they didn't know.
How do you feel that this will change with the changing and evolving landscape of general practice and the change in consultation?
Because some of those changes seem inevitable, such as the growth in part-time working and larger GP practices. So how can we defend the things that are important about continuity within that environment? And some of the things that are going on, like the growth of e-consultations, could have a big harmful effect on continuity, or maybe could be delivered in certain ways that protect continuity.
We've been talking to Professor Chris Salisbury and Dr. Mairead Murphy about continuity of care. Thank you very much, Chris and Mairead.